Welcome to the Omni Dental Podcast. Today, we are taking a deep dive into one of those dental mysteries that almost everyone wonders about at some point. Wisdom teeth. We're really going to tackle that big myth. Does getting your wisdom teeth actually make your jaw bigger? Or, does taking them out shrink it? It's a piece of folklore that just won't quit. And you, the listener, you really need the facts on this.
And our mission today is to just cut right through that folklore. We're synthesizing the clinical facts about these third molars. We'll get into the evolution of the human jaw and really detail what happens when things go wrong. And just so you know, all the information we're drawing on today comes directly from the resources provided by the dental experts at Omni Dental and Medspa in Arlington Heights, Illinois.
Perfect. So we've got a great structure for this deep dive. We'll bust that jaw size myth first, using a bit of science. Then we'll really get into the nitty-gritty of why wisdom teeth cause so many problems. And finally, we'll walk through the removal process and recovery, and also introduce the great source behind all this info. Okay, let's unpack this.
So the core question, the scientific and, clinical answer is just a clear no. Wisdom teeth do not make your jaw bigger. They don't permanently change its shape.
Okay, that's a relief. I think a lot of people picture their face sort of reshaping itself in their early 20s. But if the size isn't changing, why does this myth have so much staying power? People swear they feel it.
Well, and what's fascinating here is just the evolutionary timeline. Our sources point out that the human jaw evolved to the size. It is now a size that, comfortably fits 28 teeth about 10 million years ago.
10 million?
Yeah. So these wisdom teeth, they're the last 4 molars. They're basically, as the sources call them, evolutionary leftovers. They show up so late, usually between 17 and 25, and by then, your jaw has completely finished its major growth.
So the construction site is closed, but these last 4 workers still show up. The space is already taken.
That's a perfect way to put it. So when you perceive your face as looking bigger, what you're actually experiencing are the effects of inflammation, not bone growth. If a wisdom tooth is impacted or it gets infected, the swelling in the gums and the soft tissue can make your cheeks look puffy. Your face can seem a little fuller, but it's all temporary.
That makes so much sense. So it's a soft tissue issue, not a skeletal one?
Once you deal with the tooth, the swelling goes down and your face goes back to normal. Okay, so if the jaw isn't growing for them, let's get into the real problem. Here's where it gets really interesting. What actually happens when they try to force their way in?
This is where things get complicated. Anatomically, there just isn't enough room. So the teeth, they often erupt at a strange angle or they get totally stuck. That's what we call impaction. Impaction just means your jaws don't have enough space for all 32 teeth to come in properly.
I always just pictured impaction as, a tooth hitting a wall. But there are different ways they can get stuck, and that changes how dangerous they are, right? That's absolutely right. The angle of impaction really determines the kind of damage it can do. A vertical impaction, for example, means the tooth is pointing the right way, but it's just stuck under the gum line. Not enough space.
Okay, that sounds like the least bad option.
It can be. But then you have horizontal impaction, and this is often the most problematic one. The tooth is literally growing sideways, 90 degrees off. Its crown is just pushing directly into the roots of the tooth right next to it.
Oof. That sounds like a disaster waiting to happen. What about the other types?
Then there's angular impaction. The tooth is tilted either forward or backward. If it's tilted forward, or what we call mesial impaction, it's driving right into that second molar, creating just immense pressure.
So it's not just a passive problem. It's an active force pushing on your other teeth. What kind of actual damage can that do besides just being painful?
The risks are pretty varied. First, you've got the structural damage. That constant pressure can actually cause bone loss around the second molar, making it weaker. Second, even if the wisdom tooth only pokes through the gum a little bit, it creates a trap, a perfect little hiding spot for bacteria.
A spot that's impossible to clean, I'm guessing.
Impossible. You can't get a toothbrush or floss back there effectively, so it becomes this hidden hub for decay and infection right at the very back of your mouth. And if you leave it, it can cause chronic pain, severe decay on both teeth, and serious gum damage. It can even lead to jaw stiffness or make it hard to open your mouth all the way.
And I read that it can mess with your other teeth, too. Like, can it undo years of braces or shift the alignment of everything else?
It absolutely can. While the wisdom teeth don't make the jaw grow, that pressure can definitely cause crowding and shift the alignment of your other teeth. If it messes up your bite, the sources say you might even need more extractions later to fix the problem. It's often much safer to just deal with them proactively.
Given they show up between 17 and 25, that's such a busy time in life. If someone isn't feeling any pain, is there really a rush to deal with them?
This raises an important question, and the answer is almost always yes, for your long-term health. A lot of the time, the most dangerous wisdom teeth are the ones that are silent. By the time you feel that sharp pain, serious damage might have already happened. That's why dentists are so focused on monitoring them with regular x-rays. They can see the problem coming long before it's an emergency.
Okay, let's shift to the solution then. If the x-rays show a problem and removal or tooth extraction is the answer, what should you expect from the procedure?
Well, it's typically a minor surgery. The first step, and the most important, is making sure you're totally comfortable, so the area is numbed completely with a local anesthetic injection.
And once it's numb, how do they get an impacted tooth out? I think people get nervous hearing words like pulled or twisted.
Right, but it's a very controlled process. The surgeon makes a small incision in the gum to get access to the tooth. If the tooth is really stuck under the bone, it might be divided into smaller, more manageable pieces. That allows for a gentle removal without putting too much stress on the area. Then, once it's out, the site is cleaned and closed with a few stitches.
That sounds intense, but it's actually pretty quick, isn't it?
Yeah, the surgery itself is usually pretty fast, generally around 30 to 45 minutes, though it really depends on how complicated the impaction is.
Okay, now for the part I think everyone really worries about, the recovery. What are the absolute must-knows for aftercare? What's the biggest risk?
The recovery is so important. The biggest risk by far is getting an infection or a complication at the site. The sources mention a pretty surprising statistic that in the U.S., about 1 in 10 wisdom tooth extractions might result in a post-operative infection.
1 in 10, that's high. So how do you avoid being that one? What are the non-negotiables?
It's all about protecting the blood clot that forms in the socket. That clot is your body's natural bandage. If you dislodge it, you can get a really painful condition called dry socket.
And you dislodge it by creating suction in your mouth.
Exactly. So that means no drinking through straws, absolutely no smoking, no forceful spitting or rinsing for the first day or two. Just take it easy, rinse gently with warm salt water after 24 hours, and you can take something like paracetamol for the pain.
And what about getting home from the appointment?
Ah, that is such a critical point. You absolutely cannot drive yourself home. Between the anesthetic, the numbness, maybe feeling a little dizzy, you need someone to get you home safely. It's just not worth the risk.
That's incredibly practical advice. And since these are just evolutionary leftovers, once they're out, they're gone for good, correct? They don't grow back.
That is the good news, yes. Once they're removed, they are gone forever. The procedure is a permanent fix, and you're left with the 28 teeth your jaw was actually designed to hold.
This has all been such clear, factual information. And it all comes to us from the team at Omni Dental and Medspa. Let's talk a bit about them and their approach.
Absolutely. Omni Dental and Medspa is a practice in Arlington Heights, Illinois, over at 305E Rand Road. It's led by Dr. Belis Poles, who has over a decade of experience in general, cosmetic and preventive dentistry. He has a real focus on complex issues like dental injuries and emergencies.
And what I find so interesting is their whole approach. It's not just about fixing a single tooth. It's this integrated philosophy of health and aesthetics.
It is, and you can see it in their services. On the dental side, they cover everything from general dentistry, deep cleanings, root canals, all the way to advanced treatments like dental implants. And of course, they have a strong cosmetic dentistry practice with things like Invisalign and teeth whitening. They even have emergency dentist services, which is so important.
And then there's the Medspa part that really connects the dots between a healthy smile and overall facial aesthetics.
It does. They offer services like Botox, fillers, hydrofacials, and even permanent makeup. It all reinforces this idea that your oral health and your overall confidence are deeply connected.
And for our listeners in that part of Illinois, who do they serve?
Well, they're focused on Arlington Heights and all the nearby communities, so places like Buffalo Grove, Palatine, Mount Prospect, Schaumburg, Wheeling, pretty much that whole area. Their goal is to bring that comprehensive care to the whole community.
That's great context.
Yeah.
So to wrap this up, what we've really learned today is that the jaw size myth is officially busted. It's all about inflammation. The real danger is impaction, and keeping an eye on those third molars is just crucial.
And this raises that important question, right? You have to monitor them because you don't want to wait. You don't want to leave this thing unnoticed because by the time it hurts, the problem has already escalated.
Exactly. And, for a final thought to leave you with, if our jaws evolved 10 million years ago to fit 28 teeth, and these leftover third molars consistently cause problems for us now, What does that say about where we're headed? Will evolution eventually just get rid of them altogether?
Right.
Will future generations not even develop wisdom teeth? It's a fascinating thing to think about.
A very fascinating possibility. For anyone with more immediate concerns, or if you want to explore the services we talked about, you can contact Omni Dental and Medspa directly. Their number is 847-483-8833.
Thank you so much for joining us on this deep dive. Until next time.